Assalamualaikum warahmatullahi wabarakatuh. My name is Naisha Natasha binti Ishaq. I am from class SR 1134C. My metric number is 2019295558.
Assalamualaikum warahmatullahi wabarakatuh. My name is Syaira Sazrin binti Muhammad Azlan. I am from SR 134C. My metric is 2019295794.
Assalamualaikum. Hi, my name is Ahmad Hakim Ahmad Karudin. My metric number is 2019896974.
Assalamualaikum warahmatullahi wabarakatuh. My name is Yashibin Muhammad. I am from SR 134C and my matrix number is 2019284314.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Atika Bintiwan. I am from SR 113-4C. Okay, so my matric tag number is 2019279622.
Assalamualaikum. Hi, my name is Muhammad Hakim Syahmi bin Muhammad Sabri. My matrix number is 2019469814. So I'm from SR 113-4C.
Okay, what is SOAP notes? SOAP note is a progress for someone to always see the progress of the patient during treatment. In SOAP notes, you may know SOAP is stand for what. First, S is stand for subjective, O is stand for objective, A is assessment, and last P is plan. So in this assignment, we do for elbow injuries for golfer. We must search an athlete and search about his history to make a report. So what is elbow injury? Our elbow joint is made up by cartilage, bone fluid, and ligament. Tendon and muscle at our body is help the elbow joint to make a movement. If you having heart structure or disease, you may having elbow injuries. Most of all the injury is caused by repetitive strain, either from athletic injuries or other form of overuse. It is because if we overperform into the repetition of a muscle, you also can leak into the strain. Strain can occur into the elbow injuries. There are three categories of elbow injuries. First, soft tissue injuries. Second, bone injuries. And last, nerve injuries. So that's all for my presentation. I will pass this present to Ahmad Hakim.
Now, I'm going to be presenting about the anatomy of injury area. The majority of elbow injuries occurs as a result of trauma. A single traumatic event such as high energy fall or chronic repetitive overuse can cause this. The elbow is extremely vulnerable to damage and cannot be immobilized for long periods of time. With extended immobility, it is common for stiffness and lost motion to occur. The most common effect of traumatic force being applied to the elbow is a fracture. A fall on outstretched hand or the direct landing on the elbow might cause this. Elbow dislocations are most commonly caused by a fall onto an outstretched hand, which causes hyperextension of the elbow. The bicep muscle is primarily responsible for supination palm up of the forearm, but it also a secondary elbow flexor. The brachialis is the elbow major flexor. A distal bicep rupture occurs when the nearly extended elbow is forced to expand against the force of the fully tense biceps. Patients typically experience a pop and bruise on the medial forearm. The inside of the elbow is affected by medial epicondylitis, a kind of tendinitis. It occurs when the forearm muscle tendons link to the bony portion on the inside of the elbow.
For the types of injuries of Woods, he's experienced two types of injury, which is the first is golfer's elbow. So this injury commonly known as medial epicondylitis. So where exactly the pain can feel. So golfer elbow causes pain and inflammation inside of the elbow and also the forearm. Plus, this happen when come to overuse and tear of the tendons, bones and muscles. The second one is elbow hyperextension. This situation occur when elbow is bent back with the wrong way. Next, overstrengthening can cause damage to the ligaments and affect structure of the elbow. Elbow hyperextension also causes instant pain when the arm is forced straight.
So now, I would like to continue on presenting for the subjective of this slide, which is the Tiger Woods history of injury. Tiger Woods has suffered a lot of injuries and surgeries throughout his whole career. Based on this slide, it shows the list of his injuries that happened on July 2007 until August 2019. His injuries were the ruptured ACL, the fractures in tibia, back spasm, Achilles tendon injury, sprain, elbow injury, neck and oblique strain. All of these injuries happened during his game, which is when he played the golf. However, he also experienced a few injuries due to a car accident, which happens on 2009, 2017 and 2021. The next slide shows about the symptoms that he experienced for all of his injuries, which is the back spasm shows the symptoms of feeling of tension, cramping and chronic pain at the lower back. Next, the neck strain that shows the symptoms of having a stiff neck, soreness, swelling and also a sharp pain. The oblique injury shows the symptoms of swelling, stiffness, weakness and bruising, while the ACL injury gives the feeling of pain, swelling and popping or snapping sound. That's all from me. So now I would like to pass the presentation to Isha.
Hi, Assalamualaikum. So now I am going to present our next slide, which is the causes of the elbow injury. Elbow injury is caused by a repetitive strain, either from athletic injuries or other forms of overuse exercise. So this injury occurs when the athlete repeat an activity over and over again. So I give you example like sport golf. The professional world player Tiger Woods, who had elbow injury back in 2013 because he kept practicing golf exercise over and over again, and this is why he had the elbow injury. So elbow injury occurs when fragment of the bone had begun to chip and roll around loose in the arm. Okay, the next point is the three main mechanisms of injury. The first one is valgus stress mechanism, which is the most common and high injury incidence. The next one is posterior translation, and the last one is posterolateral rotatory instability, which is the most common encountered pattern of elbow instability. Next, common injuries of the elbow that involve muscle, such as ulnar collateral ligament injury, is known as UCL, which occur often because of the repeated stress from overhead movement. The next one is valgus extension overload, as known as VEO, also known as thrower arms, happens when the elbow is overused. Last but not least, the osteochondritis dissecans, as known as OCD. It is a disorder of articular cartilage and subchondral bone. This osteochondritis dissecans is same like UCL because it involves repetitive stress from overhead movement. Okay, so now let's move to our next slide, which is signs and symptoms that can lead to elbow injury. When you are about to expose to elbow injury, you will feel tingling around your elbow area, swelling on your elbow. You will feel numbness, pain, weakness, and last but not least, a decreased range of motion, which means you are not being able to completely straighten your arms.
Now we move to the objective. Repetitive usage of the joint during sports like tennis or golf or vocation like carpentry causes many elbow sprain or strains. Overuse of the elbow can irritate the tendons that connect their forearm muscle to the bone, causing them to bulge, strains or rip, resulting in condition known as tennis elbow and golfer elbow. This injury can happen to anyone who participates in any sports. During a physical examinations, the doctor assesses how well you can bend and extend your elbow and rotate your forearm as well as whether this movement produces pain. He or she may also perform a physical examination of the wrist, neck and shoulder to see if injuries to these regions are causing elbow pain. Imaging studies may be recommended by a doctor to confirm the diagnosis and difference between a sprain and a strain. With medication and home treatments, the majority of cases will improve. The doctor may recommend surgery as last resort if your symptoms do not improve. An open medial epicondylar release is the name of the procedure. So that's all for my presentation. Thank you.
Now, the assessment slide explains about the athlete's biography, which for Tiger Woods, his real name is Eldrick Thorne Woods, that born on 30th December 1975. His parents are Earl Woods and Clotilda Woods. He received his education at the Western High School and also Stanford University. He was married to Ellen Nordegren for 7 years and having 2 kids. He is a professional golfer and an entrepreneur. His salary was estimated to be around $50 to $60 million per year. The next slide shows about his elbow injury that could occur on the left side of his hand in the year of 2013. It was happened during the US Open game, which makes him unable to finish his game and withdraw from it. After being diagnosed, he was advised to take a few weeks rest as he was suffered from the sprained elbow. He took a few weeks off by resting and having a regular physiotherapy session, and he also taking an anti-inflammatory medicine in order for him to reduce the pain. That's all from me. So now I would like to pass the presentation to Shahmi. Thank you.
Next is for plan treatment. The first treatment of method is the uses of non-steroidal anti-inflammation drugs or NSAIDs. NSAIDs is other method that works and helps our body as the painkiller, so it can reduce pain, prevent blood clots, so that the injury can get well faster. And lastly, and famous use is for decreases inflammation. So there are also a few things for preventing golfer elbow. First is we can make a lighter weightlifting or just squeezing a tennis ball for strengthening the forearm muscles. And of course, for one that do not want to skip the training, he or she can use lighter graphite clouds before change with the usual one. And last but not least is always stay hydrated with water before, during and after the game.
Okay, firstly, what we should do if we have elbow injury? Okay, so first, we need to rest. Okay, rest from activity that will bring pain to you was really recommended. Okay, so next, when you are doing any arm activity, try to stretch your arm before and after it. Moreover, try to not overexert yourself. Lastly, make sure you are using. Okay, so that is for to do. So what about don't? Okay, so first, don't repetitive activities involving your elbow too much. Then, don't sit in a slouched fashion to do a desk work. Other than that, don't play game at any gadget too much while you are in pain. And lastly, it is important to stop any work and exercise when you get injured. Lastly, here is some rehab program you can have during having elbow injury. For the first phase is inflammation and protection phase. Okay, so this phase is during week 0 to 3. The goal is to maintain elbow stability and prevent joint stiffness. Okay, so first, you will sling your hand at 120 degrees. Remove it if you want to do any activities. Okay, exercise recommended during this phase is forearm resting on forehead. Okay, so joint flexion or extension under 30 degrees. Okay, second phase is fibroblast and early remodeling. It is during week 3 till week 6. During this phase, we will continue to maintain motion while preventing instability. So, sling was remolded to 90 degrees. Exercise recommended is forearm ROM. Okay, so your elbow will flex it to 90 degrees. So perform this exercise in sitting and standing. Okay, lastly is scar maturation phase during week 6 to 12. It is to achieve max ROM and make sure you can return to normal activities. Okay, so you will not wearing any sling. Exercise you will do is isometric exercise. Okay, so the using of equipment is very recommended, such as elastic band. Okay, so last but not least, begin functional training. So Thank you.
For summary up all this presentation, we get a new knowledge about the elbow injuries. Golf is one of the sport that always having elbow injuries. And other than that, elbow injuries also involved in any sport such as tennis, swimming, and any sport that involve throwing object. After that, if you want to prevent from this injury, you may also must warming up before you started to play golf. This is to get your blood flowing and also raise your muscle and temperature. Then, if you follow all the step by step to prevent from getting this injury, you may avoid these injuries if happen. In addition, if someone having elbow injuries, they also can refer into this slide. This slide give many information. This slide also give an example of athlete that having this. So, elbow injuries also can make worse if someone not do the treatment from early. If you are prevent these injuries from early, you may avoid this from happen. At last, I think that's all from us. Thank you so much for watching. We are very sorry if make any mistake and wrongs. Thank you and Assalamualaikum.